Hi, my name's James Rippey, and this is a brief review on ultrasound artifacts, and it's part of our course, so hopefully you'll find it useful. Now, ultrasound artifacts are something that appear on the image that you get, but they're not really a true representation of what's going on in the tissue underneath. And they're due to a number of things. One's the nature of ultrasound. The next is the way that ultrasound interacts with the tissues. And the third is because of the way ultrasound, the machine works and it interprets the returning echoes. Now, artifacts can be really useful in ultrasound. They can help us see things or interpret things in a special way to make diagnoses. But they can also be really annoying because they can hinder and degrade the image. Now, I know this this video of me in the screen is going to get annoying too, so I'll be pleased to know that that's going now. And here we are without the annoying video. Now, assumptions have to be made by the ultrasound machine in order to produce the image. And the first of these is that the ultrasound beam travels in a straight line and is reflected directly back to the transducer. And you'll discover through this little lecture that that's not always true. The next assumption that the ultrasound machine has to make is that the speed of ultrasound in tissues is uniform. The next assumption is that the time of the returning echo is directly proportionate to the distance from the transducer. So this means that the ultrasound machine times how long a returning echo takes to determine where that echo is coming from. If the time for a returning echo is really quick, the object that the echo is bouncing off must be close. If it takes a long time for that echo to return, the object that the ultrasound is bouncing off must be further away, and the image corresponds to that. The next assumption the machine has to make is that the loss of echo strength is uniform with distance from the transducer. The ultrasound beam is sort of like a torch beam. Further away, it gets weaker. And so you can imagine if an ultrasound beam is bouncing off something a long way away, the returning echo is going to be very weak, even if that thing that's being bounced off is a good reflector of ultrasound. So what the ultrasound machine does is it artificially increases the strength of an echo that's taken longer to return to it, so it matches the strength of an echo that's come from something closer. That's kind of hard to understand, but I'll come back to it. Now, there are 6 main groups of artifacts. The first is attenuation artifacts, and that's where the ultrasound beam is weakened artificially. The second is called beam dimension artifacts, and we're going to go through each of those in great detail. The third is depth of origin artifacts. The fourth, beam path artifacts. The fifth, equipment setting artifacts, and the sixth, interference artifacts. And the good news is we're not going to go through those in such detail. So first, attenuation artifacts, and the first of these is actually acoustic shadowing. When an ultrasound beam travelling through soft tissue hits a stone or bone or gas, because of the big difference in acoustic impedance, almost all of that ultrasound beam is reflected from the stone, bone or gas interface, and it's either reflected or absorbed. So what this means is that the area deep to that stone, bone or gas interface doesn't get any ultrasound beam because it's all been reflected or absorbed. So nothing behind the stone or bone or gas interface can be interpreted, and you get what we call an acoustic shadow. An acoustic shadow can be really useful because if you've got a bright reflection with a shadow behind it, a dark shadow, that means that that bright reflection must be stone or bone. Now, calcium and bone tend to cast echo-free clean shadows or black dark shadows, whereas shadows from gas, you still can't interpret anything deep to them, but they're often partly filled with reverberation echoes, and the result, what this means is instead of having a dark shadow, you get a dirty grey shadow behind gas. And obviously our body with bowel gas and lung has lots of this artifact cast. The other next important thing is that shadows always line up in the direction of the ultrasound beam, and the extent of the shadow depends on the size of the interface compared to the beam width. So here we have a longitudinal section taken with the linear transducer of the second interspace. You can see the rib, and behind the rib a clean black shadow is cast. You can also see lung, and the top blue arrow points to the pleural surface. Behind that you can see a dirty grey shadow. Now behind the rib and behind the pleura you can't interpret any of the information. All you've got is shadow, but one's grey shadow from gas and one's black shadow from bone. Acoustic shadow. Here we've got a longitudinal image taken with a curvilinear transducer further down into the abdomen, and you can see bowel gas. Now bowel gas is obviously in intestines, and I tend to think of it looking like cumulus clouds with the shadowing being rain behind. So you can see the arrow pointing to the bowel gas where you're getting a bright reflection, and behind that you can't interpret anything. And you can see, as I move the little arrow, you can see here is the cloud, and back here is what we call the rain. But this, you can't see anything back here. This is all artifact. And although it's homogeneous grey stuff, it's that dirty grey shadowing. It looks like something. Actually, if there's a dirty grey tumour there or a cyst, you wouldn't see it, because all you can see is the interface here and nothing behind. Here we've got some gallstones. This is the gallbladder here, and 2 gallstones. Behind each of these stones is a shadow, and that shadow lines up. Here the ultrasound beam comes down from here in this direction, and that shadow lines up in the direction of the ultrasound beam. So you have a bright stone with a shadow behind it. So we have a stone with a shadow. Again, you can't interpret anything behind. So that's post-acoustic shadowing. The next artifact in the Attenuation Artifacts group is called post-cystic enhancement. And here the assumption that's incorrect with the machine and the cause of the artifact is that loss of echo strength is uniform with distance from the transducer. That's not always true. Now, it's probably easiest to describe this using an image, which I'll do in a second. But a cystic fluid-filled structure with no internal echoes doesn't use up the strength of the ultrasound beam as much as a solid structure. So the intensity of an ultrasound beam isn't reduced as it travels through a cystic structure. Now let's go on to this picture here. Remember, this is the gallbladder filled with bile. Imagine an ultrasound beam coming through here. Now the strength of that ultrasound beam isn't weakened as it travels through this bit of bile here until it starts hitting the back here. An ultrasound beam that travels down here, though, is weakened in these soft tissues as it travels down, down, down. So if you've got an echo that's returning from the material here, the strength of the ultrasound beam is actually going to be quite strong when it hits here, and the echo that comes back quite intense. And so the tissue down here, although it's exactly the same as the tissue here is portrayed as brighter, whiter tissue. The tissue here, the ultrasound beam has been weakened all the way. By the time it bounces back, it's relatively weak. Although it's the same tissue, the strength of the returning echo is weaker, and then the picture that's made is a darker picture. So in short, what's happening is behind the cystic structure, you get a bright area which is called post-cystic enhancement. So behind the stones, you get shadow. Behind the cyst, where there are no stones, you get enhancement. You get extra brightness, as opposed to the increased loss of brightness behind the stones. The next artifact is called edge shadow artifact. The assumption the ultrasound machine makes that's wrong is that ultrasound beam travels in a straight line and is reflected directly back to the ultrasound transducer. Well, unfortunately that doesn't always happen. When an ultrasound beam hits the edge of a rounded structure, it can get refracted away. And again, this is best shown with an image. This here is an image of the neck. This is the internal jugular, and this is the carotid artery. The ultrasound beam comes straight down here, hits the edge of the rounded structure and is refracted away. And so instead of being reflected back from behind here, no reflection happens from directly behind the edge of the rounded structure. So this little line here is actually an artifact, and that's because the edge of this round carotid refracts ultrasound away. In short, what you need to remember is behind a rounded structure, you often get two little black lines from either edge. That's artifact, and it's because of refraction. The final one of the attenuation artifacts is called dropout. And this happens when a depth is selected that's beyond the penetration of the ultrasound beam, and so no beam reaches it. Imagine you've got a torch and you're pointing at something which is just beyond the torch beam's reach. You're just not going to see it. So what happens is that no returning echoes come to the ultrasound machine and no image is cast. So if you were using a particularly high frequency transducer to examine a liver, you just wouldn't see the back of it, and the back of the image, the liver image, would be black because there is no returning ultrasound beam. And that's not because there's a big black structure at the back of the liver. It's just because the back of the liver is too far away for that ultrasound beam, just like the torch beam isn't quite reaching something out of its range. The next group of artifacts is called beam dimension artifacts, and they relate to the fact that the ultrasound machine assumes that each ultrasound beam is just a thin single line, but actually an ultrasound beam is rather like a torch beam. It narrows to a focal point and then gets wide, and that makes bright things like needles appear wider than they really are on the ultrasound image, particularly when they're inside a fluid-filled structure. So this is a very full bladder, and here the ultrasound machine assumes that the ultrasound beam is a thin line down and all echoes will return from inside that line. But actually the ultrasound beam is thicker, and some of the echoes that return to the ultrasound machine are actually returning from the outside bits of that beam, not from the very center. But the image that the ultrasound machine makes just relates to the central beam, because as you know, there are many individual beams sent down here in a sequence and each one interpreted individually. So if we look at this picture of the bladder, it looks like there's something in the back of it, that maybe this is sediment that's actually gathered in the base of the bladder. But when we think about it, the ultrasound beam is a single beam that comes down. In reality, it's wide. The ultrasound machine thinks it's thin. The edge of the ultrasound beam hits the bladder here and gives some reflection back. The ultrasound machine has to assume that that reflection is coming from the center, where actually on the image, it should be black here, but because it's coming from the edge, the reflection is coming from the edge, some grey is put there, and that's because of a beam width artifact. The beam is actually wider than that single line, which the ultrasound machine would like to think it is. To complicate things further, as well as this torch-like beam, the ultrasound machine also sends down side lobes, which again cause artifacts, which are actually lobes that come off like this, that can also hit and reflect echoes, and the ultrasound machine thinks of them being a single central line. So you can get artifacts cast by side lobes, which are sort of like increased beam width. This is a picture of a needle transversely inside an internal jugular, and you can see it looks wider than it is. You get the central bright echo here, and then these sort of wings on either side, which are artifact, and that is because the beam that comes down here, the edge of it hits the wire, there's some reflection back, although not a huge amount, and then the ultrasound image is cast saying, okay, well, from the line that I think is coming down here, there's a little bit of reflection, so we'll make something grey here, which is in fact reflection coming from this. The beam that comes down here hits this, and you get a very bright white reflection. The beam that comes down here, the edge of it hits here, and so you get some grain here. The beam that comes down here, though, ends just here, being about this wide. It doesn't get any reflection from the wire, and so the image is black here. That's beam width dimension artifact. The next group is depth of origin artifacts, and that includes reverberation, comet tail, and ringdown. The assumption the ultrasound machine makes is that ultrasound is reflected directly back to the ultrasound transducer from whatever it's reflecting off. But that doesn't always happen. Imagine here we've got two parallel reflectors. The ultrasound beam comes down, hits the first, bounces back, and the image is one bright line. Some of that ultrasound beam, though, goes through and hits the second reflector and then bounces back. And so the ultrasound image shows one straight line and another one behind it. And that's a true reflection of what's going on in the tissues. But things get complicated now. Some of that reflected ultrasound from the second interface hits the back of the first interface, bounces back again, and then bounces back to the ultrasound probe. So the ultrasound probe is now getting a third reflection and draws a third line. That is artifact, and that's called reverberation artifact. And that can happen again and again, and you get repeated reverberation artifacts. And here you can see it with that wire that's inside the internal jugular. You can see the ultrasound beam is going to and fro inside the wire here, and each of these lines here is artifact, reverberation artifact. And here it looks like a comet tail, and so it's called comet tail artifact. Here's that same wire in longitudinal section, and again you can see that repeated reverberation artifact. The next group of artifacts is beam path artifacts, and the one we'll talk about is mirror artifact. The ultrasound machine has to assume that the ultrasound beam goes in a straight line and is reflected directly back to the transducer, but it doesn't always happen like that. This is a picture of a liver. So this is the liver, these are hepatic veins, this is the gallbladder, and this is the diaphragm. Now, the ultrasound machine sends down a beam in this way and has to think that it goes down here, and any reflections or echoes it gets from down here. But what really happens is the diaphragm acts as a mirror, because you've got air behind here and a big difference in acoustic impedance between the liver and the lung. You're getting reflection here. So your ultrasound beam hits the diaphragm, reflects off this way, hits something in here, bounces back, and then returns to the ultrasound machine. Now the ultrasound machine thinks that reflection is coming from back here. So the picture you get is of this appearing here. So in normal lung, what you get is above the diaphragm looks like the liver, because it's essentially just a mirror image of what's lying to the right of the diaphragm. That's called mirror artifact. Now, if someone's got a pleural effusion, like here, the ultrasound beam actually does go on into the pleural effusion and bounce back. And so instead of it looking like liver above the diaphragm, you get a black triangle, which is pleural fluid. And as the patient takes a breath in, the lung comes down into that pleural effusion, and when the lung actually hits, then you get your bright white reflection with that grey shadowing and acoustic shadowing that you can't interpret anything behind. But again, you can see that some of the ultrasound machine beam is going through until it hits that fluid, it hits that lung, and you're not getting the same mirror artifact in this image. The next group of artifacts is equipment setting artifacts, and gain setting incorrect settings is probably the most common of those. Now, gain is the brightness of the ultrasound image. So it's just how bright you put the image on your screen, and it's an adjustment that you can change. So if it's set way too bright on your machine, The fluid-filled structure, which is meant to look black, looks grey or white. If it's too dark, you don't see much at all. So gain settings are important to get right, and we'll go through that in the How to Do an Ultrasound lecture, which is next. And the final group of artifacts are the interference artifacts, where electrical interference can interfere with the image on the screen, and that's usually quite obvious. Like in this image, where you see the liver and the diaphragm with a small pleural effusion above it, and this recurrent electrical interference. So quite clearly an artifact, and it's electrical. We'll just end with a quick quiz. This is an ultrasound of the right upper quadrant. It shows the liver, the gallbladder, and a big gallstone. This is an artifact behind the stone. What is it? Acoustic shadowing, that's right. Posterior acoustic shadowing behind a stone. You can't interpret anything deep to that stone, and there's a dark shadow. What about this? It's far brighter here than it is in the adjacent liver. Why is that? Post-cystic enhancement, that's right. Now here, the liver looks all black. Why is that? That's called dropout. That's because the ultrasound beam just isn't getting down there to interrogate the liver material. It's too weak and you're getting dropout. So artificial blackness. It's not like there's a cyst, it's just dropout. Now what about this? Inside the gallbladder, which should be black, there's lots of grey reflections. Why is that? Is there sludge in the gallbladder? Is there pus in the gallbladder? Or is it something else? Well, this is probably a combination of artifacts. There's beam width artifact, where the ultrasound beam is interpreting something out here and drawing it in here. There is reverberation artifact, where some of the ultrasound beam is bouncing back and forth between little bits here and casting reverberation shadows in here. There may be something from side lobes, and it may be that my gain, my brightness is set too high, particularly up here in the top of the screen. So there are a number of things, artifacts, that may be making it look like that. And we've got to be aware all the time that in our ultrasound, what looks like it's there may or may not be, depending on a number of artifacts. So that brings the lecture to an end. I hope it was useful, and we'll see you on the course. Cheers.